Tonight, a brutal reality in the war against COVID. 1 in 5 U.S. hospitals is facing a staffing shortage.
We can turn areas that aren't hospital areas into hospital areas, but if we don't have the people to take care of the patients, it doesn't matter.
Since the pandemic began, an army of traveling nurses has rushed in. First to New York City, where they were cheered daily. Then to other hot spots.
When I was in New York, people seemed a lot more supportive of healthcare workers.
Right now, traveling nurse Lauren Wildeboer is in South Texas in a COVID unit.
A lot of people say that COVID is a hoax, that masks don't work, that masks are politicized. It's frustrating trying to correct people.
Throughout the country, there are 40 to 50,000 traveling nurses taking on assignments. But now, during the pandemic, they're in demand like never before. According to Trusted Health, a nursing job posting site, the nurses' fees are now twice as much as pre-COVID levels. Right now, there are thousands of open jobs.
The supply of nurses is being tapped out. They're on assignment doing the heroic work that they've been doing for the now 9 months. The front lines are seeing death daily.
With North Dakota allowing infected but asymptomatic workers to treat COVID patients, 60 Air Force nurses are now headed to that state as backup.
We're tired, we're physically and emotionally exhausted, we're pretty much at our breaking point.
For this latest wave, the most dire shortage nationwide is not always beds, ventilators, or protective gear. It's people. Gabe Gutierrez, NBC News, Des Moines, Iowa.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.